Okay, you can see my screen, hopefully. And just to go through what Valerie shows, I did my panel management several years ago before this panel management dashboard came on board. So most of mine was done with report by templates. And so I didn't actually use the dashboard very much for mine. And I wish I had it at the time when I did it. Would have made it a lot easier. So as Valerie said, on your Oscar page up here in the top is right beside administration is your dashboard. If you hover over dashboard, you'll see the different items that Valerie mentioned. You won't see this calculate BMI item in most of your systems. I added that as when we were doing a different project. But so as Valerie said, you can look at your CDMs. When you click on it, you can see how quickly it loads, or that doesn't quickly load. It does take a little bit of time on your system, depending on how many people are using it. So definitely try to do it when there aren't a lot of users on your system, because it does occupy quite a bit of server energy to run certain things. And you can see how many patients you have, their suggestions, how many billables, how many are up to date. Okay, you click on options. Okay, the temptation is to click on the pie, right, to see things. It doesn't work. You actually have to click on options. And then, as Valerie said, you click on the indicator info and whoops. Let's try that again. Each time you load it, it goes through and searches everything all over again. If you click on options, you click on indicator info, it will show, here's the query, right? You don't have to read the query, but if you're looking for ICD codes, here it's for billing codes. And then, where's the ICD code? Perhaps not this one, but you'll see different.
It's right down near the bottom of the query. I just happened to see it third from the bottom.
There it is, right here. Yeah. Okay, so 428, right? This is the code that it's looking for. So in different items, that's where those are kind of things you're looking at. Okay, so and then if you want more information on the actual patients that are listed, you click on drill down. I'm not going to do that because it's going to actually show real patient data on my system. So if you actually want to see who this one person is missing, then you click on drill down. And same thing with the other features. Now, the one thing about diabetes and hypertension, you may have some that are hypertension, is if you have diabetics who are hypertensive, when you label them both, they'll show up. But because you can only bill for, for the CDM, the diabetes and not hypertension at the same time, you may have some hypertensives that are not billed. So understand that. I've actually chosen not to list my hypertensives who are diabetics, just so that I don't get that duplication. But if you do enter both of them, you will have some hypertensives that are not billed for you, okay? So this is the change dashboard provider button that Valerie mentioned. And so you click on that and you have different numbers in your practice, okay? This is where you do adjustments in your dashboard, what we call the dashboard manager, okay? And you can turn on and off different searches in your system. On our system right now, we're having some problems with the active patient part. And it's there's a query that runs in a huge loop and it locks up my system. And so I've actually had to turn it off in order to run this right now. We're trying to sort that and fix it up right now. So I have it turned off, but for my active patients, it's not working properly for me. But if you wanted it back on later on, once it's fixed, then you just turn that back on like that, on and off, okay? And then you can see all your different, there's a whole bunch of different ones there, okay? Val mentioned, I don't know if you did mention or not, Val, but you can edit the dashboard by clicking on it and changing titles and adding things, okay? And when I mentioned that I had added on a dashboard item, you can add and import just sort of like what you do with e-forms and stuff like that with coding. It's not something most of us will do, but if you did need to do it, this is where you do it. go back to the dashboard. So, okay. And so panel management 1, click on that. And so it would then, as Val says, shows all different things. So I did do a bit of a slideshow, or sort of a video of my running through the system with some real data that's been blurred out because there's no way I thought I could actually show that happening. So I'm going to try running a video. Hopefully that'll work. Okay, let's try that. And share sound is on. Okay, hopefully this will work. And you see a new screen and there should be sound. All right, so you can see here, this is the home page for Oscar, and up on the top here is the dashboard that has been mentioned. So we can see here that there's different items in the dashboard. And so we'll start with panel management here. So if you click on that, you'll see that it loads, but you'll see that the there's one that actually takes quite a while to load, and that's the active patients. So this was done before I turned it off. The queries are somewhat glitchy and does take a while to load. I'm going to advance the video. You can see here that the description for panel management 1 shows what items are here. You can edit this later. You can change the dashboard provider. You can see the items that are listed here in this panel management screen. You can see that there's still items trying to load here. There's a CDM for advanced care planning, and then on similarly for frailty and for polypharmacy. So let's click here. You can click on the pie. And not much seems to happen, but if you click on options, you have to actually click on drill down. And in this case, because I don't believe it's finished loading, it won't do anything at this point. So let's try something else, like the no assigned primary. It says there of all the assigned primary patients, there's actually 6 with no assigned primary physician. So let's see what the details are of that. Let's click on that. Having no assigned primaries, you can sort them by patient name, birth dates, and different parameters. You can click on specific patient IDs. Let's choose this one. You can see that confirms that there is no patient assigned to this chart, no physician. So if we go back to the dashboard, and we can check on patients with, let's say, polypharmacy. And you can see that, again, there's a list of patients, and with the number of medications they have, your ability then to click on the individual patients and see them. There's an actions section here where you can choose all or none or assign ticklers. So let's go back and let's close this off, and then we'll go back to the dashboard and we'll look at panel management. It does search through your entire database, so it can take a few moments to load. As you can see, it has entries for hypertension, chronic liver disease, ischemic cerebral vascular disease, heart failure, ischemic heart disease, chronic kidney disease, diabetes, COPD. So let's use the example of chronic kidney disease as it is loading. And number of patients with low GFR and who I have identified as having chronic kidney disease. So it's showing that I may not have entered all my information properly. So you can click on that. And if that doesn't work, you have to go down and drill down. Wait for it to load. And then we have a list of patients with chronic kidney disease as indicated by their last GFR, when it was last done, and as you can see, the different parameters. And you can decide if you want to select all in the view, and I would, as suggested, keep the entries small. You can go up to 100, but then you would do bulk changes, and you may not want to do that. You can assign a tickler or add to the disease registry, or you can exclude patients from the indicator results going forward. So if you see that they have a low GFR, you may want to have certain ones listed, maybe not all of them. If say if they have a GFR of 94, perhaps you want to have the cutoff at 60. So do none, and you want to just do only the ones that are quite low. So you want to choose those ones, and then you can add them to the disease registry of having chronic renal failure. And you confirm that. We can see here that you can edit the dashboard. We'll just choose, say, panel tools here. If you click over here, which allows you to edit which panel items you want to see on your dashboard here. This is the one that's causing me problems, so I'm going to turn that one off. You can go through and look at some of the other items as you go through and decide if you want them to be visible or not. You can create and edit dashboards. This is where you can edit the names. Okay, so other names, and then save as you need. Okay. You can create dashboards. That's a very high level function that we won't discuss too much at this point. So going back to the dashboard, close that. Now if we open up the dashboard again, we'll see now the active patient is missing. And so hopefully everything will run a bit faster now. So yes, I won't win an Emmy Award for that one, but just wanted to show one more thing. So the reason for having a good, clean dashboard and having your data up to date is to be able to analyze it properly in the future. So there's, and the reason that the PSP is working so hard with us to, do this panel cleanup and get all this stuff done is to be able to analyze your data properly in the future going forward, because you can make a lot of decisions about how well you're managing. So you can look at it within OSCAR, and I'm going to just take a couple of minutes and show you what the next stage of assessment of your system is. And that's using another tool that is not within OSCAR, but uses your OSCAR data, and that's the Health Data Coalition, or HDC. And so I'm just going to show you just a second what you can actually do with that data. So through HDC, right, you can sign in. You can sign in when using their Discover tool. And with it, you can look at your data. And this is where the really interesting information about your data can be looked at. Takes a few seconds to load. One of the first things I looked at is my patient pyramid. Which is to get an idea of how my patient profile differs from others and stuff like that. So it does take a few seconds. So this is provincially of all the HDC clinics across the province in terms of their breakups in male, female, and stuff like that. And so if I look at my own, I can see that my patient profile skews a little bit to the younger end, right? And I actually have a lot more female patients than I actually thought in middle age. So that was interesting. There's a slide here for the PSP program. All their different panel management items are all listed here that Val was talking about. So you can see all the different panel items that PSP works with you for, and you can look at that and just see how well you're doing. You're wondering, how am I doing with my COPDs with pneumococcal? Oh, not very good. But when I compare myself to the province and stuff like that, this is the province, and I can see, well, I'm actually blue, but in this case, I signed myself up with another physician in what we call the Fraser Northwest subgroup, but that other physician has not accepted. And so it ends up that I'm the only member of this subgroup. So you'll see that this one and this one are the same, and it ends up orange overrides the blue because they're both identical curves. So you're looking for me instead of blue, you have to look for me in orange. So this is my practice. And I've actually done better over the course of the last year and a half, especially with COVID. I guess I was being a bit more cognizant and making sure all my patients got pneumococcal vaccines. But you can see how well or not well I'm doing. Okay. You can see prevalence of diabetes as well in my practice compared to the province. So my practice is similar to what is in the province. You can see how well I'm doing with my A1Cs, right? And you can see how this is where COVID would have really kicked in, right? I can see that actually my patients are actually still doing fairly well compared to what's happening across the province in terms of getting A1Cs done. So, and then how well you're doing with diabetics and blood pressure. And this is an interesting piece of data. And you can see how when COVID kicked in here, essentially the number of patients getting their blood pressures just absolutely just went off a cliff. But overall, I've been doing fairly well. So you wonder how you're doing, and that requires you to enter your data properly especially this is where, you know, it really comes down to when you're entering blood pressures, make sure you put them in the measurements, not just free data. Because if you put free data in your text, in your charts and stuff like that, it won't show as an actual blood pressure measurement. Even though you've done it, you won't be able to pull it out. So it goes back to proper data. And then you look again with how am I doing with my patients with diabetes and A1Cs. And, you know, I'm not going to keep going, but not bad. And in between. So I tend to let my diabetic patients run a little bit higher, I guess, than the rest of the province. But so you can go through it and have a bit of an idea of how well you're doing. And then I'm just going to do one more just to show the importance of proper labeling. Okay, and that is, oh, actually, it's right here. So I show mental health. When I ran this, and it said how many patients I had met with major depression and a visit in the last year, and I've got 0, which a lot of people have. And I thought that's very strange because I have quite a few patients with major depression, which I've labeled as major depression in my billings and stuff like that. But this requires you to actually put it in the disease registry. And so in this case, it's a problem with pulling out the data. So if I want this to be accurate, I need to put my patients with major depression into the disease registry as well to show that. So that was interesting. So, but it's just helpful, you know. So to be able to look at your data, perhaps you can you have an ability to share and compare it with colleagues, which is what this subgroup is, as well as we have it for the entire Fraser Health, Fraser Northwest Division, all of Fraser Health, and provincially. So you can see how you're doing in increasing groups and stuff like that. So a bit of interesting information. If you're interested in something like that, then all you have to do is go to type in HDCBC for Health Data Coalition, and if you're interested, you click on Enroll Now, and you can enroll into something like that and have access to the HDC app, which connects to your data. And so that's as much as I can share with that. Okay.